As I mentioned, for those just jumping onto the call, you have found your way to moving upstream together, furthering your vision for child and family well-being with free technical assistance. We're so excited to welcome Barbara and Lydia, our partners in prevention with Strategies TA. We're so thankful to have you both here today. Take it away.
Thank you so much, Jess. Hi, I'm Lydia Marquez. I'm a Senior Technical Assistance Specialist with Strategies Technical Assistance. And we provide, we'll talk more about what we provide, but I will let my colleague Barb introduce herself.
Good morning, everybody. Thank you so much for being here today and coming to learn about the TA that we have available for you all. My name's Barb DeGraff. I've worked with many of you. I work primarily in the mountain region of the state of California, and I come to you from beautiful South Lake Tahoe, where we're hoping for snow today. And we'll go on, tell you more about Strategies TA in just a moment, but thrilled to be here and hope you have a lot of good ideas for how we can help support your work.
I forgot, I'm joining you all from Orange County, which it does feel like it's about to snow today for Southern California folks. 63 degrees is very cold for us, so definitely feels that way. So Strategies Technical Assistance supports county prevention teams, child abuse prevention councils, family resource centers, and other networks with the implementation of their prevention plan. So you might have heard those referred to as CPPs or comprehensive prevention plans. And we will also be supporting the work in advancing county community pathways. We'll talk a little bit more about that as we go on today. We are funded by the Office of Child Abuse Prevention. And these are our vision, mission, and values. I think our values are what we really hold in this work, and I think they're so great and so important. And that's accountability, equity, collaboration, community voice, and strength-based. So I just want us to keep that sort of spirit in all of the things that we're going to do today, because that's definitely where our work comes from. So I'm going to go ahead and put us to the next slide. Barb can talk a little bit more about the kinds of work that we do.
So Strategies has been in business for many, many years, but currently with our current contracts, which we're going to talk about a little bit more today, the areas that we can help you with, we have consulting available in sharing subject matter expertise, trying to link you up with folks that can help you do your work, developing different products, and we'll talk a little bit about some of those things like strategic plans, process consulting. We can help support you in your work, facilitating meetings, leadership coaching, working one-on-one with leaders, or even 3-on-1 or 2-on-1 to try to help you gain the skills that you need to do the work that you want to do in your community. Help with information gathering. We know there's so much out there, so much information. So we hope to streamline and put you in touch with the latest information to help you, again, do your prevention work, and group capacity building. So again, helping with your collaboratives, making them strong, vibrant programs. Some of the things that we've done and hope to do in the future in our new contract, online learning opportunities like this one, but more expanded, regional networking events where maybe we'll bring together different groups like rural communities that have special needs. Some of the things that we've done in the past, we've done rural learning exchange cohorts. Many of you participated in those, and we appreciate that. And then for those of you that have participated in our statewide collaborative prevention convenings, we've worked in partnership with a team, and last year we had one in June. It was a hybrid, and if our friends at Caltrin could drop into the chat, we do have a save the date for our convening that is going to take place in March of 2024, which I can't believe we're talking about 2024. One of the things that I do want to just share with you about Strategies is we're a collaborative. So we work together. As Lydia said, Lydia's down in the southern region. The Children's Bureau is our partner. I work up in the northern region, and we're from the we come from the Child Abuse Prevention Center. called the CAP Center. And so we work together to cover the entire state of California and do the best work that we can to support your work in child abuse prevention. If you want to go to the next slide. Oh, I want to just say one other thing before we continue. As we go through the presentation today, we really, really hope that if you have any questions, we have 31 participants, so we're a small group. Many of those participants are from strategies. So, you know, we really want to have a dialogue with you. The information is a little bit on the dense side, to be honest. So please feel free, if you have any questions, drop them in the chat. We're happy to stop, answer your question to the best of our ability. We have our whole leadership team on the call. So if there's anything that I don't know or Lydia doesn't know the answer to, we have our leadership that can step in and help us. And also, if you feel comfortable, feel free to raise your hand and you can be unmuted, and then you can ask your question and we can answer to the best of our ability. Because we really want you to leave today coming away with some ideas of how and if strategies can support your work. So let's start with our focus area. So we're funded by the state of California Office of Child Abuse Prevention, like our partners, Caltrin. And these areas, these 3 areas noted here, are in our contract with OCAP. So these are really the child abuse prevention priorities for the coming year. So one of the things we really want to help counties do is support the development of pathways to prevention services throughout the state of California. What we want to see is children and families finding the services that they need before a crisis occurs. We want to avoid the need for a referral to child welfare. We want to make sure that only those most in need enter the child welfare system. The community pathway concept is a key piece in the comprehensive child abuse prevention plans. And you'll hear us, and Lydia mentioned, talk about CPPs. Those are comprehensive prevention plans that many counties have been submitting throughout the last year to the California Department of Social Services under the Families First Prevention Services Program. So community pathway is a key part of how do families access services that they need before a crisis occurs. The other piece that we really are focusing on is strengthening the statewide prevention movement. And how do we do that? We co-host events like the statewide Child Abuse Prevention Collaborative coming up March 4th and 5th. We're organizing CAPC leaders to identify statewide needs so we can work together. The idea being that we're all rowing in the same direction. And throughout all these activities, we want to elevate the voice of the live voice of the community. We want to elevate the voice of our tribal members and leaders. And we want to ensure that the systems that we develop truly reflect the need of the people that we are hoping to support. So next slide, please. So a little bit more about community pathways for those of you that maybe are not as familiar. So what do we mean when we talk about a community pathway? Well, there's a few pathways to prevention services, and the most narrowly defined community pathway is associated with accessing services under those comprehensive prevention plans. And the services that are eligible for federal reimbursement are called evidence-based practices. And because we love our acronyms, we call them EBPs. I'll try not to use them as much as possible, but forgive me if I do. So if you're familiar with your county's comprehensive prevention plan, and we hope that you are, that's one of the things that we really want to emphasize. This narrow pathway is how will families access the evidence-based practices and programs that are outlined in the comprehensive prevention plan. How are families assessed for eligibility? Where do they go for services? So that's the most narrow definition of a community pathway. Then we think about expansive community pathways. And this is the broader context. How do we move the system in your county from what now is, in many cases, a mandated reporter, where folks feel if I see an issue or a need, I have to report to child welfare, to a community supporter? Again, how can families access the services they need so they don't have to be referred to child welfare? Because we know that across the state, the vast majority of child welfare referrals are neither opened or even investigated because they don't rise to that level of child abuse or neglect. These families, as you well know, many of you, are just experiencing a stressor. And if we could just address that stress, the family would be able to function and function well without the need for child welfare involvement. So addressing those stressors is, as opposed to adding another stressor, which is a child welfare referral, which is a huge stress for families. That's really the broad definition of a community pathway to prevention. So we want to help counties and communities develop those pathways for families. And then in the third bullet, we talk to developing a system that makes community pathways robust and effective. And how do you do that? You make sure you have the right partners in the process. You make sure that the partners have what they need. And most importantly, one of the things that we focus on is ensuring that voice of the community, people, the voice of lived experience and the voice of our tribal members are included in the development of these pathways. So I'm going to turn it over to Lydia for the next slide.
Okay. So Strategies TA works collaboratively with the county as a strategic thought partner, sharing resources and making connections to move the community pathway development forward. And one thing I want to say about like how we're supporting these different organizations and entities is, you know, we are really focused on this technical assistance being tied to the community pathway and the community pathway development, as well as the comprehensive prevention plan. And so some of the ways that we like build capacity in counties is providing leadership coaching, developing communication plans, and also providing community engagement plans and strategies. I think that's something that we see throughout the state is always an ongoing challenge that we're so excited to really help tackle. We also help facilitate network development by bringing cross-sector partners together so that issues can be discussed and conflicts navigated. But all of these activities are interconnected. And what would that actually look like in terms of what we're actually providing? For County Collaborative, we can provide education about resources available to sustain initiatives, help in the development of policies and procedures. And again, going back to our values, looking at some of those policies and procedures and making sure that community is engaged, tribal and community voice is centered in those things, as well as equity. And then also things like identifying and monitoring outcomes for initiatives. There are a lot of moving parts in community pathways, and we are also going to be assisting collaboratives in developing or connecting with, like, for example, data platforms to ensure that the services are meeting intended goals, also connecting with subject matter experts. Although we have an excellent team of folks that know a lot and have a lot of really great experience. We also know what our limitations are. We also know when we need to reach out to, you know, some of those folks that is really their bread and butter. CAPC and CAPC networks, we can help with the implementation of CAPC best practices. So if you're not familiar with the CAPC best practices guide, we will rely heavily on making sure that those best practices come forward, assisting in expanding social media reach and accessing the community and tribal voice in membership and activities. So we can help facilitate a network of CAPCs and host peer opportunities. In fact, that's something that we're working on is creating this CAPC statewide network, and CAPC is Child Abuse Prevention Councils. For FRCs and CBOs that are already a key community pathway for families to, you know, get services, we want to ensure that the FRCs are connected to the community pathway. We have a lot of those existing relationships with county child abuse prevention planning teams who are now going into the implementation phase and the planning of the community pathway, so we can help facilitate connections. Trust and believe, we are definitely making sure that CBOs and FRCs are part of those conversations. And so we can help facilitate those partnerships and help, you know, develop some of that community engagement. Okay. So, in terms of services that we can provide to advance community pathway, so things like strategic planning, governance and collaboration, centering community and travel voice, which I think is such an important piece to this. Have you ever heard that saying, there's nothing for us without us? And that's really sort of what we want to center, is that, you know, community needs to be an active part in all of these different processes, helping to develop county CBO partnerships, community asset mapping, support with data needs. I will say setting data targets for change is really what we're talking about in terms of supporting data needs. And that just means that, you know, we are going to be connecting with resources that provide provide the ability to do that. And then other areas, you know, we might be assisting with supporting, researching funding for primary and secondary prevention. For example, we are tapping into Alex Briscoe from California Children's Trust as a subject matter expert when it comes to the new CalAIM program. So we're definitely going to be looking at accessing subject matter experts for the larger field to learn more about some of these new and emerging initiatives.
And I just want to add to that, that on the other areas, there may be something that you need that we haven't really thought of. So don't feel like we're limited here. We hope that you will think about, you know, some other areas that we could explore with you. And so we're very open to exploring areas where we can support. So we're going to just talk a little bit about each of these areas, just to give you a little flavor for what we're thinking about. But again, we hope you'll think about the things that you need, because you know best, you know, what kind of assistance you might require. So in the area of strategic planning, we're really talking about kind of two phases. The first phase is we want to, first of all, provide some kind of a readiness assessment to determine your capacity to do strategic planning. I think a lot of times we want to do strategic planning, but when we come down and we learn what's really involved, where we come away saying, you know, that may not be something that we're able to do right now, given our staffing limitations, et cetera. So one of the first things we want to do, if you're interested in strategic planning, again, around child abuse prevention activities, we want to make sure that you have the ability to do this work. So we would start out with looking at a workshop, maybe 1 or 2 days, where we would talk to you and your leadership team about what would be involved in strategic planning. If you decide, yes, you know, we want to move ahead with this process, we don't have the staffing to write a strategic plan. But in sort of the second phase, what we would like to do is walk alongside you and take you through the key components of a strategic plan. You know, what's your purpose? What's your vision? Your core values? How do you develop goals? How do you keep track of progress in meeting the goals in your strategic plan? Who's the audience for your strategic plan? Sometimes the audience could be your board, staff, management, the greater community, all of the above. So those are sort of some of the key questions that we would want to ask. But really what's important is we can provide the support, but do you have the capacity to not only complete the plan, but then move forward with the plan? I think many of us have been involved in organizations where we've done a plan and it kind of sits on the shelf because we can't get to any of the items within it. So we want to make sure that it's a relevant and helpful process. And that's one of the things we can explore with you. Lydia, I think you're taking on the next one.
Yes. So we can also support with governance and collaboration, and really, I think, grounded in the Building Community Resilience Toolkit, we really want to think about like identifying key elements of successful collaborations, documenting a collective structure, applying principles to support effective engagement, and really assessing your collaborative with guiding questions. And so what that means in layman's terms is basically, you know, we will sit with you and talk about, is this collaborative successful? Have you engaged the right people? Are the right people at the table? And really looking at, how do you engage, you know, particularly we know a lot of organizations struggle with engaging folks with lived expertise, and the tribal community. So really working to make sure that we are sharing engagement strategies and techniques that are authentic and intentional. And also, how do we, create a culture where people feel that there is equity and participation, that you are engaging the community that is around you, and that making sure that the governance structure is community focused. Okay, so let's go on to the next slide here. So CBO and county partnerships, I think we are definitely always looking at how can county departments really connect with community-based organizations, including FRCs, including CAPCs, and are they currently involved? Who's missing? So using the community engagement toolkit from the collective impact is one thing that we are very centered on. I think that's an excellent toolkit. If you haven't seen it already, I think we could probably drop that link into the chat for you all just to take a peek. But we really want to make sure that we are looking at this work in a community-centered way. And we want to also make sure that we are, helping folks think about doing this work in a way that is equitable.
And another area that we're happy to work with counties, FRCs, CAPCs, et cetera, is on community asset mapping. And for many of you, you may have been involved already in an asset mapping process, which is basically looking at what are the strengths in your community, not just the agencies, but also individuals, citizens associations that really are positive resources for your community, because a lot of times we don't include those when we're looking at our assets. We really hope that community asset mapping, if we're working with a local entity, can it help to empower community members so that they can become that advocate for the services that they need, because it's the most effective way really to get new resources. But one of the things that we really want to work with entities on is looking at what's already been done in your community. Those comprehensive prevention plans that we mentioned numerous times now should have at least a beginning of an asset map included in them. So one of the things we want to look at is how can we build on what's already available in your community? And again, what is the purpose of the community asset map? Why do you want to do this activity? So we would explore these questions with you. What you want to identify gaps? Do you want to develop new services or programs? Are you trying to bring in new groups? So that's really our focus of community asset mapping. Okay, next slide. I think it's also me. And then we talked a little bit about data needs, and we wanted to just share a little bit more about that. So one of the areas that we look at is, how do you know you're meeting the goals that you've set forth, whether it's in your strategic plan, whether it's in your comprehensive prevention plan, whatever the goals are, how do you know? So, we look at the key data questions. How much have we done? How well did we do it? Is anybody better off? If these ring familiar to you, it's because these are the key questions from the result-based accountability framework, which is one of the frameworks that Strategies TA would like to bring to your data analysis. We also would utilize the data playbook for child abuse prevention, which was developed by Safe and Sound and is an excellent resource for what are some of the key data sources that you can begin looking at to identify your community goals, then your program goals, because that's really how you can identify, are we working together as a community to address the problems that we see in our child welfare system. We want to highlight areas of disproportionality where you see certain racial or ethnic groups that are overly represented in child welfare. We want to, why is that happening? Are they overly represented in referrals, in case openings, et cetera? And we really want to look at that equitable access to services. We also, one of the areas in the CPP, that the comprehensive prevention plan, that counties are struggling with is the data sharing. So this is an area that Strategies TA can help explore with the counties. I can't say that we have an answer right now, but one of the things that we do know is what other counties are doing, and we can bring that to you. So, so how do you share data about families in a way that maintains confidentiality, et cetera? So those are the areas that we really hope to help you with. And again, relate back to how are you implementing your community pathway to prevention, because all of our efforts are focused on child abuse prevention in your community. And Lydia, you'll take the next one.
All right. So, one of the ways we will also, and we've alluded to this throughout our presentation thus far, but, really looking at, are you centering community and tribal voice in the work, and helping to assess this, your collaborative or your group or your organization on where you are in this community engagement spectrum that I referred to previously. Like, what are your goals for engaging your community, and develop a plan to move you from one level of the spectrum to the other. I think, we're definitely always looking at connecting the larger community. One of the things that we've heard time and time again is that community-based organizations or people in the family strengthening field want to connect with each other. They want to know what each other are doing for all of these different challenges. And so I think being able to do some peer sharing is something that we are definitely focused on, creating opportunities for connecting to the statewide network, creating peer sharing opportunities, also supporting you all and your partners in sharing resources such as webinars, developing strategies that highlight tribal voices and those with lived expertise, because we know that that is something even on the national level that is being highlighted recently, as just this, including folks with lived expertise as experts in the field, creating strategies and tools for the statewide network, such as a community onboarding toolkit, which we're developing for child abuse prevention councils. And we do have learning modules, which I think are really helpful to provide some capacity building around some of the processes that can help push your work forward. For example, a theory of change. I know that a lot of comprehensive prevention teams did a theory of change as part of their plan, but there's some of you who thought that it would be a good idea to do that for your CBOs. So, it was kind of like a refocus. And so we can provide a learning module around things like that. All right, Barb.
Yes, I was just looking. I see a question in the chat that was a direct message to me. So Hector, I hope I'm not. I hope it's all right that I share with the group. But his question is, thank you for providing this TA. Wondering if we have county offices and CBOs represented here today. So I haven't looked at the participant list as of right now, but I know we had county offices and CBOs signed up. I don't know if they're participating right now, but we certainly, yes, Shanita, thank you, Shanita. But yes, we definitely want to outreach to our community-based organizations and county offices. And once we're finished with this webinar, we will have it recorded. We're going to put it up on our website, as well as Caltrin will have it on their website. So we hope you'll feel free to share it with any entity that you think may benefit from TA. Thank you, folks, for sharing if you're a CBO. So in terms of child abuse prevention councils, what can we do to assist you? We have it's a large focus of our work in the coming contract. One of the first things we wanted to talk about, and I'll just briefly go through these three areas. We want to focus in on those CAPC best practice guidelines. This was something that was developed back in, I think, 2020, maybe 2021. And we also have a webinar that accompanied this best practice guidebook. So we want to really focus on helping CAPCs examine themselves to identify, look at these three key roles. What are the roles that you are interested in providing? One, two, or all three? I mean, each CAPC may be different depending upon its capabilities. And we'll talk about each three in a moment. But the key area here is that we would walk hand in hand with the CAPC, meeting with the board, meeting with members to try to identify what is your goal for your CAPC and how can these roles assist you. And we can start out with Lydia will talk a little bit more about the catalyst.
Sorry, my mute keeps disappearing, so I'm not sure if it's a sign from the universe, but
No.
you know, the CAPC best practice guide really outlines the roles of CAPC. I think there are three significant roles that they play in the community. And I think one of the most important, and I think one of the most visible roles that they hold is as a catalyst for prevention. And really what that means is that, you know, they are the organization or the hub that is inspiring and promoting civic and community engagement in protecting children and preventing maltreatment. So advocating for policies and laws, making sure community knows like what is child abuse, how do we prevent that? I think now our state is moving towards this idea of child and family wellness. So it's going beyond that, where we want to make sure that our communities, our families within the communities and children are healthy and safe. And so some of the ways that strategies can support this is helping to brainstorm what we call primary prevention activities for the community, such as like outreach materials, events. So some of the ways we've done this in the past is, you know, helping CAPCs with some of their social media presence, or helping them with some of, you know, thinking around some of the activities they're doing in the community for outreach. For example, San Luis Obispo did this amazing campaign about normalizing parenting. So normalizing some of the struggles of parenting, and they took to social media to do that. And from what I understand, it had been really successful. We didn't really do it. But I think we were, you know, helping to provide a few strategies for them on social media, and those are the types of things that we can do. I think concretely what that looks like is, you know, when we can help create like posts and templates for posts. So these are some of the things we've done in the past for other community-based organizations as well.
And sorry.
Go ahead.
In terms of convening cross-system partners, and obviously one of the key areas that we would look at is, you know, who is at your table, and looking at the welfare and institution code, you know, who's required, who's recommended to be on the CAPC, what are some of the barriers you might have, is child welfare at the table, probation, you know, some of those key areas that are crucial to supporting children and families. And then strategies can help you with ideas and ways. If you need to bring other folks to the table, how can you do that? We can share what other counties have done. So for example, many counties may have like a smaller CAPC team, but then they have associated with them a larger community team that brings in, you know, the live voice, et cetera, et cetera. So those are some of the areas that we can help strengthen your cross-system partnerships. Lydia?
All right. And so another role that CAPCs take on is as a coordinator of countywide prevention activities. And so what we've been seeing in many of the comprehensive prevention planning teams is the CAPC working with the county in providing different supports. So for example, we might see, you know, CAPCs that are providing what we call secondary prevention services, so like home visiting programs. So some of the ways that strategies can help, you know, support these efforts are being able to provide capacity building on tools that can help roll out programs, or for example, we have some CAPCs that are part of a larger regional collaborative, so we can help like with their outreach for events, or help them with logistically coordinating those events. Those are things that I think administratively can take a lot of time. And when CAPCs have very small staff, may not have the capacity to do that. So we could help support, do things like that.
And I do see a question from Lindsay Call, First Five Kern. Thank you, Lindsay. Her question, I work for First Five Kern, a funder of 15 FRCs around our county. There are varying sizes, including some tiny ones in rural areas. Are your services available to FRCs and CBOs of all sizes? And yes, the answer to that is yes, we are. Again, focusing on that whole idea of how can we help the FRCs and the CBOs become a part of that prevention pathway in their community. For me, an FRC, just by the name, Family Resource Center, you are a key prevention pathway, in my view. And one of the things I think we'd love to work on, Michael has raised his hand to help out with that answer.
But don't let me interrupt. Keep going.
No, go ahead, Michael.
Oh, just yes, and we're especially interested in supporting FRC networks.
Yes.
I'm going to make a plug, and in a minute I'll put a thing in chat on December 12th. The California Family Resource Association is going to have its, and I know Lindsay, you're a member. It's networks committee meeting with a focus on FRC. Actually, first 5 FRC networks. A couple of I don't know if folks are on the line from Butte or San Bernardino, but we'll be doing some peer mentoring of those with those folks because they're new and forming their FRC networks in their counties. And so it'd be great to have other networks, especially first 5 networks there. So I'll put that in chat.
Perfect. Thank you. That's great. So yes, please reach out and we will work with you. Again, what we want to do, and we'll talk a little bit more about this in a minute, we want to work with leadership and really identify what's the goal of the technical assistance. But we're open to all ideas and questions. So we're getting toward the end here, so I'm going to kind of go a little faster because we're running out of time. As always, we always think we have more time than we do. The last thing we want to talk about is our role in strengthening the statewide prevention movement, and we're so excited about this. Strategies is working with CAPCs throughout the state of California to develop a statewide CAPC leadership group. This is a really new and exciting concept. We want to provide strategic direction and guidance on policy, priorities, and the development of an ongoing support for a statewide CAPC network. And this network would obviously interact with regional networks as well. We're hoping that this group, which just started meeting, will develop specific priorities. We're going to collaborate with all our relevant partners, and we're going to really provide that structure for hosting CAPC gatherings. And again, regionally, statewide, and demographically based, because some of the things we know are that, there's a real big difference between a CAPC in a rural community in California versus some of the more urban, larger communities. So we can go to the next slide. And just as I was saying, we had our first meeting September 20th, where CAPC leadership from across over 20 counties came together to talk about their needs. We had our second meeting yesterday. And in the meantime, one of the things that Lydia has been working on with a subset of those leaders is developing some materials for CAPCs that they can utilize to orient new members, to orient new CAPC coordinators, just to provide some sort of a basis of knowledge for folks that are coming in as CAPC members or staff. One of the, not surprisingly, funding is one of the greatest needs for CAPCs throughout the state. Having adequate staff that is stable, because we have a lot of turnover in our state in staff, also a big need. And we know that coming together as a statewide group, we can advocate for the funding and the services that the CAPCs need to do their jobs more effectively. So,
all right. So we're going to do an activity, and I think what we're going to do is we're going to have a worksheet that's going to be dropped in the chat, and it's a fillable PDF, and thankfully for my tech savvy colleague was able to figure that out, because this Gen Xer couldn't figure it out. But so what we're going to do is have you fill out this worksheet and really think about what is a barrier to moving your work forward, the work that your organization does. And please, this is not like a TA request form, so don't get too deep into this. We just kind of want you to get those like juices flowing and thinking about how we could support the work that you're doing. So the first prompt is, what are some of the barriers to moving the work your organization does forward? Just think of 1 or 2 words. Type in 1 or 2 words. Now define it using 1 or 2 sentences. Think about, what have you tried? Have you, tried a certain kind of programming? Is it community engagement? Have you tried to reach out to your community? Who has been involved? And you can keep that pretty general, like, public agencies, county partners, your faith-based community. And then what are your next steps? What are things that you are going to try or do? And again, I don't want you to put too much brain energy into this, because it's just to get you thinking about this a bit more. We're going to give you 5 minutes to just do these different prompts, and then we're going to come back together and pick 1 or 2 folks and talk you through some of the answers that you have for this. And we're going to talk about how Strategies TA could support some of these challenges that you're currently facing in your work. So we're going to come back together. And is there anyone that wanted just to share their answers? So if whoever would like to can just come off mute, or actually we'll have you, if you want to share, just raise your hand and then we'll call on you. Sure. Okay, go ahead, Jeff.
Well, I'll get the ball rolling for you here.
Thank you. Appreciate it.
Greetings from Southern California, the San Bernardino Mountains. And so I just put, you kept it short. Consistent funding is one of the barriers.
All right. And what are some of the things that you've tried in terms of getting consistent funding?
We are constantly looking for new funders, and writing grant proposals seems to be almost a weekly activity around here, or at least monthly. And so we're also connecting with our local legislators and spending time introducing ourselves to their staff, whether state or county representatives, local commissioners such as the First Life Commission, and county council members, city council members, that sort of thing. And then I do a lot of this, attending webinars like yours today, just to make sure I'm current and make sure we're in the right stream, as you said. And I think that's what got my attention today, was that moving upstream activity. We've always been since our inception in 2001, a prevention-based agency.
Can you tell me a little bit more about your organization?
Certainly. The Mom and Dad Project is a parenting, education, and resource center, a family resource center in Big Bear Lake, California, which is a small rural community in the mountains of San Bernardino County. We've been here about 22 years now. And started out as a pregnancy service agency, and have adapted into numerous parenting education processes using evidence-based programs such as nurturing families, nurturing fathers, prenatal classes, and we do that in bilingual as well, Spanish and English.
Great. Thank you for sharing that. I think, definitely Barb has had a lot of experience working with rural communities. And I think that, she definitely has the pulse on what some of the rural community needs are. And then who's been involved in just this sustainable funding? Now, I know you mentioned some of these folks that, obviously are the funders or that have direct access to funding. But in terms of community or, the folks that are the lived expertise folks that are utilizing your services, how have you engaged them in this type of work? In trying to not just look for sustainable funding, but thinking about the sustainability of your organization?
Well, we've drawn from the local community to establish our board of directors. Those people that are on our board have utilized our services as well. And so they're very, very connected to us, very supportive. Being in a rural community, as you mentioned, Barbara, you've got that expertise. Funding is pretty minimal in a local area. I mean, we do have tons of support from Rotary, service clubs, Elks Lodge, a domestic violence agency here. We have a local collaborative because we're so small. We got to hang together. So we have a collaborative that's made up of the school district and the domestic violence agencies, Lutheran Social Services, ourselves, and a number of other agencies, churches, faith communities. And, you know, we kind of, sometimes it just turns into us sitting around and commiserating, you know, and cheering one another on to do the best we can. You know, also involved in that is the parks districts of San Bernardino County and groups like that. So we do a lot of chasing local folks and herding them around, trying to help them work together. We do a lot of referrals back and forth because I mean, we don't even have a TAD office in our community. We're 50 miles from the largest city. And so in any direction, one of three directions. And so that, I don't know, probably rambling, sorry.
No. And I just wanted to share that Michael put in the chat that the California Family Resource Association has been campaigning for state funding for FRCs and can help members with materials and logistics for legislative visits. So hopefully you're a member of the CFRA, California Family Resource Association.
I believe we are, and we've worked on a number of their COVID grants with them over the past few years. So
excellent.
Yeah, Jeff, you're a very valued member.
Michael, thank you.
Well, and I think we strategies when it comes to family resource centers, we'll be partnering with CFRA to make sure that we are combining our efforts, not duplicating efforts, to support a lot of this kind of work, like policy and advocacy. And you know, I think in terms of the kinds of support that we've provided to community-based organizations in the past is, you know, connecting them to the larger comprehensive prevention plan team and advocating for, like, you know, some of this funding that is coming through from the Families First Prevention Services Act. And so I think, you know, it seems like it's a bit of a small feat in some ways that we're just like, you know, kind of like saying like, don't forget about these folks. But I think sometimes when folks are in the macro work or they're, you know, doing the work of the planning, they, not that they forget about community-based organizations, but I think it's a great way for us to continually remind them that the community work needs to be involved in like all of the planning efforts and implementation efforts. And also I think, you know, we are looking at this work like really from like a bird's eye view, and we also have these other perspectives from other parts of the state, also other rural communities, right? So we're able to bring in different strategies and say, hey, you know, this county tried this. Have you, you know, looked into this funding? Have you seen this? We're constantly trying to figure out how to, you know, how we can strategically look at partnerships, because I think what we see sometimes is people are doing this work in silos, and so we'll see people like repeating work when it's like, how can we bring folks together to make an effort or become like a larger entity, which sometimes actually makes the funding easier for some of these larger entities that are doling it out. They're like, oh, these two agencies are partnered together to provide this parenting program. Like, this makes more sense than trying to manage two different grants or trying to manage two different funding places. So those are the types of things we think about, and we're always trying to help other community organizations think about as well. So, you know, we're definitely a thought partner in that kind of process.
And I just wanted to, we only have 3 minutes, and Hector Matias has his hand raised. Hector, what do you have something you'd like to add, please?
Just in the interest of time, and I am fully aware of that. If I waited long enough, I think it'll be covered in the conversation in our closing. But the points that are being brought up either by Jeff or Lydia, and then those that are on the, what do you call this, the chat, you know, for us, it's really about, I love that these are recorded. My concern, my question around how many counties are represented and how many CBOs, we're in Northern California, about an hour north of San Francisco. And so we're part of the California Alliance and all of these bigger meetings. And my question constantly and my search visually on the screen is, where is our county? And we're a very collaborative county. We have really good, positive pathways and relationships with them, but sometimes almost too collaborative, where it feels like, okay, like, how do we get to the next stage? So my question really, and maybe it'll be answered, maybe not, is how do we bundle this and or without me or TLC sounding self-serving,
Right.
how does that conversation translate from here to that exploratory or discovery that you're talking about with the county that we represent?
Mm-hmm.
What county are you in, Hector?
Well, we serve several counties, but our main county is Sonoma County.
Okay. And we have, Michael probably has more information because his team covers the northern part of the state, but that's a county that we have
Connection with.
Mm-hmm. So I think the good thing is that we have those statewide connections where we could
Yeah.
say, like, we know who in the county we will need to connect with.
Mm-hmm.
So I think that's one advantage that Strategies has.
And I'm just thinking, as a CBO, as a community-based organization where you really want to engage in some of these activities, if you haven't already, one of the things that we can do is explore who are the key contacts. We can do a little work behind the scenes, talking to those folks and see if they are interested in having Strategies come in and do a project. So,
okay, so really
to
quick, because I know it's almost time. So maybe a concrete step would be, if Michael covers North Bay or Northern California, if I could have Michael contact me. I am connected with those powers, if you would, at the county, but there is something about an outside entity validating that you guys know of Sonoma County and we're a lead agency. We're probably there, but that final connection and conversation really hasn't happened.
Right. And Michael's actually our boss, so it would be like one of us that would reach out to you, but happy to do so. I think if at this point, our friends at Caltrans could drop the TA request form in the chat. So we do have a form that you can fill out, but Hector, somebody can get back to you directly, since it sounds like you're already connected with us as well. But this is the way we would start our TA process. Is we'd ask you to fill this form out. It would come into our organization. Someone will reach out to you, and then we would meet with the leadership that are interested in a project. So that's really the next step for the TA. And we hope that you'll think expansively and fill out a form, even if you're not 100% sure. Shanita put a question in about Strategies sharing a list of our trainings. We don't really do trainings. Caltrans, our team here, are the trainers. So if Jessica, you could share, list, make sure that everyone's on the Caltrans mailing list, because you are the trainer extraordinaire in the state. And Jessica put a link also to the evaluation up for today's webinar.
All right. So thank you so much for joining us, and hopefully we will hear from some of you. And we'll, again, as Barb said, please speak with your leadership if you're not the leadership, just to make sure that you're on the same page about requesting the TA support. We will review the form that is sent in, and then have a discussion with you about if our support is appropriate, and if it is, what kind of support we can provide. I know that Jess and her team have dropped in the survey regarding this webinar in the chat, so please feel free to grab that survey and fill that out to let us know how it was today, and you will get a follow-up email with resources within 2 days. So please look out for that in your mailbox. And as always, you can check out Strategies website. It's www.strategiesca.org. So it's CA like California. And then also caltrans.org for trainings. They have a lot of great trainings coming up.
Yes. Thank you all so much for your time. We really appreciate your being here.